Howdy, y'all. Welcome to our podcast today. I hope you guys had a great weekend. So in today's podcast, we'll discuss exactly the reason why you have acid reflux and break down the real reason why you may have acid reflux. We'll also discuss what is actually going on inside your body, what are some other things I'm seeing when it comes to people who have acid reflux. We'll discuss a real patient story that may be related to you and some practical solutions about what you need to do when it comes to acid reflux as well. So if you're joining us for the first time, my name is Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years of treating thousands of patients with all sorts of reflux issues. If you're wondering what is going on, why do I have reflux? What is the root cause for this? Come see us. We can see you today. You don't need a referral, so we can find out what's going on, both in person and telemedicine, so we can hopefully get down to the root cause of why you're having acid reflux. So this video was inspired by a patient of mine. Let's call him Jim. Obviously we have to use names in which we don't violate any patient confidentiality, but Jim came to see me. He was a young 34-year-old man who was complaining of chronic acid reflux. He didn't know what was going on. He was not overweight. He did not eat some of the foods that trigger acid reflux. He was constantly having problems with acid reflux. And he did what normal people would do, and he searched social media to find out what is going on. And he saw all sorts of videos about why you may be having acid reflux. He saw things about having too much acid as the cause for acid reflux. He saw things that maybe having too little acid is the cause for acid reflux. He made dietary changes based on what he saw on social media, and he tried to do everything. He does not smoke. He exercises all the time. He cooks most of his meals. But despite all this, he still had acid reflux. So he saw my videos on social media and he decided to come see me. And so, I talked to him exactly what is going on, why you have acid reflux, and what can we do to get this taken care of for you. So this is a very common scenario I see in my clinic with patients who have all sorts of reasons why they have acid reflux, but also confused by what they're seeing on social media. So why do people have acid reflux? What is going on? So people think that acid reflux is due to other conditions, which I have no idea why. So first, let's talk about food. So food is a very common reason why people think they have acid reflux. And for some individuals, this can be a cause. So when people eat certain foods, let's say spicy foods, citrus-based foods, tomato-based foods, coffee, chocolate, things that we enjoy in life, they can commonly have acid reflux from this. When we look at the actual evidence behind this, I'm all about looking at the science behind things. The dietary triggers are not actually a very common trigger when it comes to acid reflux. So what I tell my patients is kind of try to figure out what is your particular trigger when it comes to acid reflux. So for me, for example, if I have a lot of beef or a lot of meat, for me, that'll make my acid reflux go crazy. Chocolate, not a big deal. For me, tomato-based foods, not a big deal. But what is the real reason why foods can be a trigger? We'll discuss that in just a little bit. Another common reason I've seen on social media is too little acid as a cause for acid reflux. I have no idea why this is becoming such a predominant thing on social media, but let's kind of think about this in terms of what makes sense physiologically. So in our body, we have what are called parietal cells. These are cells that are constantly produce acid, and they repopulate every 24 hours. Now we have these parietal cells help break down food into its smallest component, but also help out with digestion as well. Now most individuals have a normal set of parietal cells that are there, unless you have certain medical conditions. Let's say you have what's called atrophic gastritis, in which you have decrease of the cells that produce acid. If you have an infection like H. pylori, which can do the same thing, or if you take medications like proton pump inhibitors, which can also decrease acid as well. But in the vast majority of people, that is not what's going on. And the chances of you having this condition are not that common, and it's very hard for us to diagnose it without taking a look with an upper endoscopy. But also think about this also as well. Your body produces acid. And when you have acid reflux, it's not typically an acid problem. It's not a problem of producing too much acid. Even if you don't have enough acid, it will not manifest as acid reflux symptoms because you don't have any acid to produce. And if you're not producing acid, it's impossible to actually have those reflux symptoms that's going on there. So what exactly is the real reason why you have acid reflux? It all comes down to what's called the door. That is it. The lower esophageal sphincter. And that's where the root of acid reflux comes on. So you have this sphincter called the lower esophageal sphincter. It is the connection between the esophagus and the stomach. It is literally a door. And whenever this door opens, that causes acid to go up into the esophagus, cause burning and regurgitation and symptoms of heartburn. And when the door is closed, you don't have those symptoms whatsoever. So when it comes to acid reflux, our job is to find out A, is the door the problem, and then B, find out what we can do to keep that door closed appropriately. So normally when we eat and normally when we swallow, that door will open, allow food to go down, and then that door will close. Now, on the occasional basis, it may pop open. That's when you have burping and things like that. But in most cases, when you're not eating, when you're not swallowing, when you're not drinking, that door will stay closed. When it comes to acid reflux or heartburn or regurgitation, that door is open longer and more often. And that is the issue. So how does food play a role? So foods, like I mentioned before, the citrus-based foods, tomato-based foods, chocolate, coffee, caffeine, the foods that we enjoy, those foods ferment, and that gas causes that door to be open longer and more often. That is it. So when I eat beef myself and I have symptoms of acid reflux, it's not that I'm producing more acid, it's the fact that that food is opening up that door longer and more often. So that door is wide open, causing acid reflux to go up, to cause me to have the symptoms of acid reflux. It's not an acid problem, it's a door problem. So another reason why that door can be open longer and more often is what's called a hiatal hernia. A hiatal hernia is when part of the stomach goes above where it should be to cause that door, to trap acid, to cause that door to be open longer and more often. But once again, it is a door problem. It is not an acid problem. Obesity, another very common cause of acid reflux. The bigger that we are, the more acid reflux that we have. Why is that the case? That pressure that goes on your abdomen whenever you are obese causes that door to be open longer and more often. It's the exact same concept when it comes to pregnancy. When you're pregnant, you have that pressure on your belly that will also cause the door to be open longer and more often. It squeezes that door to pop open to cause those symptoms of acid reflux to get worse and worse and worse. Delayed gastric emptying or gastroparesis. This is a condition in which your stomach does not contract and does not metabolize and does not move to cause symptoms of nausea and vomiting, typically in patients with diabetes. A common symptom from gastroparesis is acid reflux, heartburn, and regurgitation. Why? Once again, you are just trapping food in that stomach, and because things are not moving, that will cause fermentation, gas to occur, and boom, that door will pop open to cause heartburn to occur. So the treatments for acid reflux is all about either trying to keep that door closed longer or to prevent the acid from going up into an open door. And that's our goals when it comes to acid reflux. So what do we do? So for this patient, I just check to see how the valve is working. I do what's called an upper endoscopy or an EGD. An EGD or an upper endoscopy gives me good visualization of what is going on. And when I do an EGD, I look for a couple different things. Number one, I take a look at the esophagus itself. Is it contracting appropriately or is there damage inside that esophagus? I can sometimes see physical damage in the esophagus that tells me, yeah, you have pretty bad acid reflux. We can see what's called esophagitis. I can see ulcers in the esophagus. I can see what's called Barrett's esophagus. And with that, I can see consequences of long-term acid reflux. Number two, I can check to see if there is a hernia that's there. You can see hernias by different mechanisms. Sometimes imaging can catch a hernia, but taking a look with an upper endoscopy allows me to see how big that hernia is and is it causing problems. Because not all hernias lead to reflux issues or keep that door open. A lot of it will depend on how big the hernia is and how wide it is, how long it is, and do I think that's the cause for your acid reflux. Number three, I can take a look at the anatomy and the structure of the stomach. Do I see ulcers, inflammation? Do I see problems with the gastritis that's going on? Because sometimes that inflammation in the stomach can cause symptoms of acid reflux. And I can check to see if you have a condition that can lead to low gastric acid as well. And then lastly, I can check for other conditions like ulcers in the stomach, cancers in the stomach, other things that can mimic acid reflux as well. But my whole goal, especially when it comes to heartburn and acid reflux, is to check that valve. Now, once I do an upper scope, this will allow me to kind of pinpoint kind of the next steps to find out what's going on to keep that valve closed or at least minimize the complications from an open valve. So how can you keep the valve closed? What are some practical tips you can do? So number one, like I mentioned before, avoid some of the trigger foods. Now, the evidence is not great behind this, but if you can notice your own particular trigger foods that make acid reflux worse, try to see to do what you can to minimize that. So like for me, for example, I try to minimize beef as much as I can because for me, beef is a constant trigger when it comes to acid reflux. Once again, it's not a matter of producing more acid. It's a matter of keeping that valve closed longer and more often. Number two, lose weight. If you are obese, weight loss by far is the most effective way for you to keep that valve closed because you're decreasing the pressure on that valve so the door stays closed longer and more often. Number 3, try different lifestyle changes to keep that door closed. So for example, not eating late at night will keep that door closed longer and more often. When you sleep, sleep on your left-hand side. That keeps that valve closed longer and more often. If you need to sleep upright whenever you're sleeping to prevent reflux from coming up, they'll keep that door closed longer and more often. A lot of the lifestyle changes that we recommend are all about keeping that door closed as much as we can. Next, try medications. Now, medications will not fix the door, but it'll keep the consequence of that door being open longer and more often to prevent you from having symptoms. These are why medications like antacids, H2 antagonists, PPIs actually work, because they don't actually fix the door problem, but they fix the secondary problem of that door being open, which is that feeling of acid going up. And so even though we're not fixing the cause of the problem, we're fixing the symptoms of the problem. And then lastly, surgery may be an option. And for a lot of our patients who have acid reflux, in which we cannot figure out or at least determine how to fix the door naturally, surgery may be an option. This is what we do for some of our patients. Now, not everyone who has a hernia and not everyone who has acid reflux needs to get surgically fixed. And so we do the workup to see if you are the right candidate. There's 2 main tests that we do. One is called a pH test. And what this test basically does, allows me to objectively see how much acid is going up into the esophagus, and is that causing symptoms? And the reason that's important is because just because you have a hernia, or just because we think the door is the problem, does not mean that's the only cause for your issues. And so this allows me to determine if that's the problem or not. And then secondly, we do what's called a manometry test. It's kind of a fancy test, but it's an uncomfortable test in which we put a probe down your nose while you're awake. Yes, you heard me correctly. And I see how well the contraction of the esophagus is when you swallow some water for about 20 or 30 minutes. My goal with that is to make sure there's no motility problem to prevent you from having surgery. These 2 tests are going to allow me to determine if fixing the door is going to fix your problem, because there's no point of us trying to have you see a surgeon if you're going to have a surgery that's not going to fix your issue. It doesn't help you, it doesn't help me, and I want you to feel better. But when it comes to acid reflux and heartburn, it's all about an acid door problem. That's it. It's not an acid problem. It's not too much acid. It's not too little acid. It's all about a door problem. So when it comes to acid reflux symptoms, and for this particular patient, that's exactly what we did. I did an upper endoscopy, and we came to find out he had a very large hiatal hernia. That was why he had acid reflux. He did everything right, lifestyle changes, but because he was fighting against an anatomical defect, no matter what he did, it was not going to work. So I talked about the risk and benefits, and he opted for surgery. He went and had the surgical procedure to fix acid reflux, and he's doing remarkably well. He's off his acid medications, and he feels so much better. So if you're trying to figure out exactly what is going on, why do I have acid reflux? Are you confused by this whole idea between too little acid and too much acid? This is the approach that I take as a Mayo Clinic trained doctor to hopefully get you taken care of. And if you want to get down to the root cause of why you're having acid reflux, we would love to be a partner in that journey and hopefully get you feeling better. All right, guys, thank you for listening to my podcast. If you like what you hear, if you like what you see, consider subscribing to my YouTube page, my Facebook page, my TikTok, and more importantly, if you're having GI issues, come see us at Lubbock Gastro so we can find out what is going on. Our job is to get down to the root cause of why you're having the issues. If you're frustrated by your health, if you're frustrated by what's going on, come see us so we can get down and get you feeling better. Thank you for listening to us. I look forward to hearing you guys on future podcasts.